We chose Arcadia because of their reputation and the ability to really serve many of our primary use cases, such as quality improvement, accurate condition coding, and managing our cost of our members. For the first time, the company has access to claims and clinical data. We had many siloed systems before, and now that data is presented in a very usable manner to our end users. So that's really transformed the way we present the data both internally and externally to our provider partners. I have a background in clinical informatics, and with that, I've worked a lot with transforming how the providers interact with technology. And one of the key drivers for adoption is making sure that it doesn't put additional burden on the providers. So as a payer, we have to be very aware of that. And we really try to serve up the data in a way that's consumable and doesn't add any additional administrative burden on our provider groups. One of the main values that Arcadia brings is that when I meet with a provider group, we are both looking at the same data. We can pull up a patient chart and we can examine. They may have a question about why a member didn't qualify for a measure or wasn't adherent to a measure, and we can explore that together. And sometimes they may find it's the way they're documenting in their EHR. It's the way they're coding it. So it's a really great opportunity to look at it from both lenses and really solve the problem together. Customer insight, technology, and provider collaboration. Those are three of our underpinnings to help guide our transformation work. Customer insight, it's exactly what it says. It's knowing our members, understanding who they are, how they seek their treatment, all those important drivers that help them to either get care or present barriers for their care. When our call center, for example, or our care managers engage with a member, if they don't know anything about that member, it's very frustrating. So they are asking them a lot of questions. It may be a very stressful time. So with Arcadia, they can do some research, they can gain some insights before they engage with that member. Same thing for a provider group. They may not realize that for some of our smaller provider groups that don't have access to our claims data, that their patients are going outside of their practice and they're really only seeing a portion of the picture and the story of that patient. It's flu season now. Who are the members that need flu shot? That used to be a report request to our analytics team. But now they can log in and they can see it almost immediately. And that was a really big aha moment for one of the groups that I was working with on a member engagement campaign. For our provider groups, we have historically sent monthly reports to them. If they have a question, they can log in anytime. They can see that information. If they're in a primary care model or another contract, they can track their progress on achieving their goals. We're starting to explore the use case with our care managers to have more near-time access to data than they've ever had before to identify those vulnerable patients and outreach them. New members, we want to be able to reach out to them. We want to be able to engage them, get them engaged with their providers, and making sure that they're following up on their care. For our provider groups, if they have newly enrolled members, or newly assigned members, we want to make sure they know about them, and we can present that as much information as we have about them and work together. Focusing on whole person health is not just the time when the patient or the member is sick. It's preventing those things to happen. It's identifying rising risk members. It's really understanding our populations and being able to tailor our products so that they meet those members' needs. When we talk about payers and providers collaborating, it's really making sure that we're both looking at the same data. They have a more complete clinical picture and we have a more complete claims picture. So putting those things together really is the secret sauce.